This video will demonstrate how to use a slit lamp. We'll just be covering the basics, so follow me. So the first thing we need to do is start with the basics, which is the power. The power switch is on the left side of this machine, facing you. When you turn it on, it should light up green. If you find it's not lighting up green, just check the power supply down here, and it plugs in underneath, and it can easily get kicked out, so that's usually the main cause of no power. Next, you just want to set up the machine for your own vision. So the first thing to note is these are the oculars here, and the slit lamp is a binocular microscope, and we need a stereoscopic view. So we've cleaned the machine already, so we move it much like binoculars. They'll move in and out. So the best way to test is with one eye. So I'm closing my left eye and opening my right eye, and just going to move, and you just need to adjust until you get vision in both. So I'm now closing my right eye, and I can't see the left, so I'm just going to adjust it, and I need it quite close for me, and that gives me a nice clear stereoscopic view. So that is the distance, the interpupillary distance that you're changing there. It doesn't take long, and you just need to do that every time for the different user. So I wear contact lenses, which I have in now. So I will have the diopters here, which are the dials, the numbers, set at 0, because my vision is already corrected. If I wasn't wearing, and there's the small arrows there lined up with the 0 and small dot there. If I didn't have glasses or contact lenses on, but I should have, if I know my prescription, I can change it. So if I wasn't wearing them today, I would change it to a -2 for me, and that would allow me to see without my spectacles or contact lenses. Okay. So the next thing I do is, obviously I've greeted the patient, the machine is clean, is to get the patient comfortable, and that's the most important thing, as well as yourself. So this machine is on brakes, which are here. They click up on both wheels, and they're both off. Sometimes the machine should be left locked, which, if you kind of have a look around on the right side, is a small screw here, which you turn counterclockwise. If you try and move it and it's locked, I demonstrate, then this needs to be unscrewed. If you can remember to lock it at the end of use, that'd be great. It just stops this machine getting damaged, but usually it will be left unlocked. So I'm going to ask my patient if are you comfortable? Yeah, okay. So the chair that my patient is on doesn't move up and down, so I need to change the machine. So I'm going to ask you just to place your feet up here for me. The handles are clean. Can you place both your hands on there and gently move the machine in towards you? Does that feel about comfortable for your knees and your back? Yes. So I'm now going to put the brakes on. If I could ask you to place your chin on the chin rest just here. I'm just going to turn the light off while I do that. And the patient needs to have their chin firmly on the chin rest. So this is the patient positioning frame here. And you can see the forehead strap, their forehead needs to be pressed against that. Some patients may find that quite uncomfortable, especially if they have arthritis or spinal problems. So do you feel comfortable in that position? Yeah. You sure? I can place you a little bit higher. Yeah, okay. Just pop your chin off for me. So underneath here, there's a lever, and you just press it up. I'm just going to raise the machine up. You can hold on to the handles. Just come up slightly. Please place your chin back on there. Okay, it looks more comfortable. How do you feel? Yeah, that's much better. Great. Now, although the patient feels very comfortable, the machine's not set up correctly yet. If you can see this line here, black mark, on the rod, this is a positioning rod, that actually needs to be lined up with the patient's lateral canthus, which I'm just pointing to now. Okay. So there's quite a way off. So what I'm going to do, you're going to use this wheel here to turn, and you're just going to feel your chin moving up and down. If it's uncomfortable, then you can just take your head off, okay? And I'm just going to bring the slit lamp slightly up as well, okay? Just slightly, well done. Okay, just pop your chin off for me. And I'm just going to, as it needs to go quite a way up. Okay, and I'm just going to lower the machine slightly. Pop your chin on. it up. Doing really well. Are you comfortable? Okay, and you can relax your chin back in there. So roughly that is in line with the lateral canthus there, and that's the most important thing, otherwise you just won't get the light lined up correctly. Okay, so just a bit more about the basic instruments on this machine. This is called the joystick. It spins to bring it up, and it spins to bring it down. So clockwise to go up, anti-clockwise to go down. And if you just close your eyes for me, and the purpose of that is, if you can see the light, we place it on the bridge of the nose. It's down here, it's not in the right position, I won't be able to see the eye. So if I just move it up, it will then be in the right position to cover the entirety of the eye. So that's how to move that. Also, when you're moving fine positions, you use the joystick. You just move you'll see if you never use a slit lamp, it'll make sense once you're on with a patient. You want to get their iris in view, you just move forward, very fine movements, just like a bit like a macroscopic lens on a camera, to back and forth. If you need to do big movements, so I want to go right over to the left eye, just hold on to this area. This is the width knob. This changes the width of the beam, which I'll demonstrate. Just move the whole unit over. So left and right, back and forth, big movements. You can see it's running on these tracks here. Fine movements. Steady it with your left hand, but just use the joystick to move very finely back and forth. Okay. So the power switch on. This is the light intensity dial. So we usually leave it in the lowest position, and it can go all the way up. So if I do that again, we start over here on the lightest position, on the bridge of the patient's nose, just to demonstrate, and it can go all the way up. Okay. So for examining lids or lashes with the eyes closed, it's fine to have it on a high brightness. For most things, we don't need the high intensity, and if your patient is light sensitive, try and adjust it as such. So back to this lever or this wheel here, this changes the width. So if you close your eyes for me, I'm just going to demonstrate on the eyelid how that can go really wide, and then it can also go very, very narrow. And if I turn the brightness up for the video, it can go very narrow. So very wide, going forward, bring it back to go very narrow. So it's you can see a very tall beam at the moment. If you want to, sometimes you need a small square to assess the iris and the anterior chamber, and you need a slit as well. So you've got your slit is on narrow, but we will need a small square now. So just turn this wheel here clockwise, and you have a small square. If you turn it anti-clockwise, it will give you a nice tall beam. And if you just saw, I went all the way to the left till it can't go any further. If you then turn left, it will click onto the cobalt blue light, which is the one you'll probably use most often in A&E. We need that for use with fluorescein drops, for looking for foreign bodies, corneal ulcers, any corneal defects. So once again, keep turning the wheel to the left and it will automatically click, can't go any further onto the blue light. Okay. Up here, this really just can be kept in this position right here on this circle. You will find when you come to the machine, it might be moved all the way over here onto the green light. That's probably if ophthalmology have been using it to look at blood vessels in the retina. I believe that's a red free light. You don't need to worry about using that. And this is the highest intensity, this hollow circle here. Leaving it on this is absolutely fine for what we need to use it for. So one thing we do often find is corneal ulcers and corneal abrasions, and it's quite helpful for corneal ulcers if we can measure them. It will allow the ophthalmologist, especially when it's out of hours, to know if they need to come in to see the patient. If corneal ulcers are under 1 millimetre and the visual acuity is normal, that can usually wait till the next morning rather than disturbing the eye doctor at 3 o'clock in the morning. But you need to just measure it. So first of all, so if you don't mind just to open your eye for me and just rest your forehead there. Okay. So most corneal ulcers are quite small, usually less than 1 millimetre. So use the height knob here to adjust. So I have to imagine there is a corneal ulcer on this patient's cornea. And I line it up with the height, and so it's going to be a little bit smaller than that. Okay, so that's the height, and I look up here, and this is in millimetres, and it does go lower than this. It will go down into tenths of millimetres. So this width is just under 1 millimetre. But I now need to do the, I beg your pardon, that's the height. I now need to do the width. So this whole arm will move, and it will change now to a horizontal beam. Just going to turn that up a little bit brighter. If I do that again and make it a bit taller so you can see, so that's a vertical beam. I'm turning the whole arm to the left, and can you see it's tilted, and it can go diagonal, and now it's horizontal will be all we need it for. So I'm just going to reduce the size. I'm going to look for the corneal ulcer again, and then I'm going to look up to the dial here, and that tells me also the width and the height are both just under 1 millimetre. So that's really important. It just takes a little bit of time to get used to, but can really help the eye doctor know whether they need to come in straight away to see a corneal ulcer. So just a few other little things. These are the handles the patient can grab onto. They don't have to, but it can make them feel more secure. We covered this raises the frame up and down. Get the mark here in line with the lateral canthus. Do you want to take a break? You can pop your chin for there, thank you. And I think that's everything that we need for the moment, the most things that you'll need in A&E. There are underneath the oculars is the magnification lever. There are two settings, currently on times 1.6, and we can move it to the left to times 1 magnification. The arm swings, and as we mentioned, the narrow slit beam is called a slit lamp because it produces this narrow slit of light. And that's useful when we want to look at the anterior chamber of the eye, which we'll discuss in a separate video. But the arm can swing out to both the left and the right. And usually it's at about 45 degrees that we'll use for the slit lamp, but we'll be covering that later as well. Thank you.